Hey everyone, I'm Dr. Atkins at Blue Oasis Pet Hospital, and I'm here today to talk to you about Cushing's disease in dogs.
What is Cushing's disease?
So, Cushing's disease, also known as hyperadrenocorticism, is when the pet's body is producing too much cortisol hormone.
What dogs are most likely to get Cushing's?
The most likely patients that we see that will develop Cushing's are kind of our middle age to older patients, and smaller breed dogs are more likely to get it as well.
What causes Cushing's disease in dogs?
So, Cushing's disease is caused by an overproduction of cortisol hormone. There's three main ways that pets can get this. So, the most common is actually a very typically benign small tumor within the pituitary gland, which is in the brain. There can also be tumors within the adrenal glands that will cause it. And then also, if a pet is on a long-term steroid medication, it can also cause Cushing's as well.
What are the most common symptoms of Cushing's?
The most common symptoms of Cushing's are usually increased thirst, increased urination, they'll have increased hunger. A lot of them will be panting more than normal. A lot of them, with their increased hunger, will be actually seeking out food very frequently. Like, they'll be stealing it off of the counter that's not normal for them. They'll steal it out of a toddler's hands, things like that are just not typical of their normal behavior. They can also get a pot-bellied appearance. Some muscle wasting can happen, and they can also have changes to like skin and hair coat health.
Why does Cushing's cause a pot-bellied look?
So what happens with Cushing's is muscle wasting can happen, and the belly kind of has that abdominal muscle, and it kind of develops with like fat distribution, and they don't have as great of a control of kind of keeping that belly tucked in anymore, so it just causes a pot-bellied appearance. And sometimes these patients can also have liver changes, and that kind of increased liver mass can cause changes in the pot-belly appearance as well.
How do veterinarians diagnose Cushing's disease?
So most patients with Cushing's disease, we get a suspicion off of our physical exam and also the owners when they're telling us why they're in to see us. And we do still rely heavily on our lab work. So if we're concerned for it, we'll a lot of times do a test called an ACTH stimulation test. Sometimes we will also do a low-dose dexamethasone suppression test. And then we can also use urine as well sometimes to diagnose these patients.
How is Cushing's treated?
Cushing's is treated with a medication called trilostane that a pet will take daily. And we really recommend kind of keeping up on monitoring after it's started.
How do vets monitor Cushing's?
So with monitoring for Cushing's, we usually recommend repeating that ACTH stimulation test or whatever test we use to diagnose them about a month after we start treatment to ensure that we are on the appropriate medication dose, because we do not want to potentially overtreat these patients and then have them become Addisonian, where we're overtreating them and they have too much cortisol suppression.
Can dogs live a normal life with Cushing's?
They can, once we get them started on treatment and we continue with good monitoring at home. We usually see these guys have a great response to therapy. Thanks everyone for sticking around and listening about Cushing's disease in dogs. If you have any concerns or you feel like your pet might have some of these signs, give us a call and we'll help figure things out for you guys.